Yesterday, we identified 802 new cases of COVID-19, and today we've identified 609 more. We also continue to see growing hospitalization and ICU admissions. As of today, there are 171 people in hospital, including 33 admitted to ICU. I know some people look at those numbers and they say that's a small fraction of our overall healthcare capacity, and they're right. But Albertans need to understand that these numbers are set to grow with the growing case count. And as we've had to change hospital protocols with more folks in self-isolation, as we've learned to how to prevent spread within hospitals, and we're facing other challenges, we must take this very seriously, because if these numbers continue to grow at their current pace, they will put our healthcare system at risk. They will put our economy at risk and our loved ones at risk. Every Albertan needs to be concerned about these numbers. We've seen how hospitals get overrun in other jurisdictions around the world. We must not let that happen here in Alberta. This is a turning point. If we don't bend the curve down now, we'll face even tougher choices in the days ahead. But if we take smart, targeted actions and each do our part, we can continue to protect people's lives and livelihoods. The truth is that COVID-19 is being spread in part by at parties, through get-togethers and other gatherings with friends, neighbors, and extended family. We're all human, and socializing is an essential part of life. But we also have to make sure that we're socializing in the safest way possible. That's what we did this past summer. Folks went to parks instead of house parties, and we kept our cohorts or groups small and stayed home when sick. We need to do that again. For example, we are not seeing widespread transmission in restaurants. In fact, fewer than 1% of active cases in Edmonton and Calgary are linked to exposure in restaurants. That's because operators and staff have worked extremely hard to adopt the health guidance and protect the health of customers, and I want to thank them all for that. Our data indicates that it's currently safer to eat out at a restaurant at a table with no more than 6 with protections in place than to attend a private gathering at someone's home. In fact, so far in November, we see about 7% of traceable cases linked to social gatherings. We are seeing that informal social gatherings with families and friends are a major driver in spreading COVID-19. And currently about 40% of active cases in the 2 big cities are linked to household transmission or a private event. And so, acting on Dr. Hinshaw's recommendations, Alberta is taking smart steps to reduce the spread. On October 8th and 26th, we implemented targeted measures to help reduce transmission and slow the rise of cases in Edmonton and Calgary. Although we did see a slowing of case growth with some of the early voluntary measures, including here in Edmonton, it hasn't been enough to bend the curve down to where we need it to be. Cases keep rising, and these voluntary measures are simply no longer enough. So, effective immediately, we are asking everyone in Edmonton and Calgary to stop holding social gatherings at home. These gatherings are the largest identified drivers of spread, often because people relax their guard at home. It's easier to mix and interact, of course, without the strict measures in place that exist in restaurants or other settings. Now just is not the time to host parties or large extended family dinners. Until cases slow, we must press pause on hosting any gatherings involving people outside your core family or immediate household. I'm confident that Edmontonians and Calgarians will heed this call. And I know this is an annoyance, and it's a sacrifice. And a lot of people will say the government has no business telling us who we host at home or what kind of socializing we do. I understand that reaction. But here's the reality. If we don't take these kinds of simple measures and make these sorts of modest sacrifices to social life, the cases will continue to grow to a point where they may grow out of control, and where the only options we have will be far more impactful on people's lives and livelihoods.
On November 4th, we identified 802 new cases. Yesterday, as you heard, we identified 609 additional new cases. Over the last 2 days, we have completed 26,483 tests. There are currently, as you heard, 171 people in hospital, including 33 admitted to the ICU. Both Calgary and Edmonton continue to see rising cases, and other parts of the province as well. Sadly, I must also report 8 additional deaths over the last 2 days. My heart goes out to all those mourning a loved one right now, knowing that there are unique challenges to grieving together during this difficult time. I am concerned about the rising case numbers, and as I have said before, the cases we are seeing in schools, in hospitals, and in continuing care facilities are largely a reflection of the transmission that is going on in our communities. This is why we are taking the steps that Premier announced today, and why it is crucial that we all take action. I know these measures will impact many people, and they are not taken lightly. For those whose wedding receptions, family gatherings, or birthday parties may be impacted, I'm sorry for the challenge this change will bring. It is critical, however, that we bring our numbers down to protect our health system and our communities. In addition to the measures just announced, I would ask all Albertans to look closely at their own lives and ways they can make themselves and others safer. If you can reduce your social circle, hold meetings or events virtually, or embrace new habits that will make those around you safer, now is the time to do it.